I will now turn to the board report. Je vais maintenant présenter le rapport du Conseil d'administration.
I will now be introducing the Board of Directors report.
Hard copies of CNA's annual report are available in your kits. For those of you on webcast, you can access the report from the participant materials link between the webcast window. At the end of this presentation, I will be pleased to take a few questions. To start, it is important to me to thank a few people. First of all, thank you so much to my employer, Ontario Shores Centre for Mental Health Sciences, and in particular to Karim Mandami, CEO, and Mary Rose Bowman, my executive assistant. Simply put, I could not have carried out this meaningful role without their constant support and understanding of my many absences and frequent pronounced distractedness. I am enormously grateful. And I'm also proud to have 4 nurses from Ontario Shores with me all this week. Please wave out there somewhere. There they are at the back. I also extend my thanks to CNA's Board of Directors. You have demonstrated commitment and courage in your governance role for CNA and our profession. Today's proceedings reflect deep thought, impassioned debate, and strong resolve to position CNA for continued success and sustainability in the years to come. Special thanks go to incoming President, Dr. Karima Velji. Karima, it has been a pleasure working with you these past couple of years. I know that your strategic and visionary leadership will further strengthen and inspire CNA in your term as President. I have received tremendous support from CNA staff members during my 4 years at CNA. To all at CNA House, thank you for your dedication to the nurses of Canada, for being such gracious and caring ambassadors for CNA, and for all of the time, talent, and thought you have each so generously shared with me. And lastly, thank you to all of you, the Canadian Nurses Association members. Merci à tous les membres de l'AIC. Your engagement with your association and with our profession of nursing is what fuels and inspires the work we do and gives CNA the power and the voice to make a difference in the health of all Canadians. Today's board report will focus on 3 areas: leadership, advocacy, and membership. In 2012, at last CNA's biennial convention meeting, the National Expert Commission proudly released its report, A Nursing Call to Action. As incoming president, I committed to you to do everything possible together with the CNA team to bring those recommendations to life. Je suis fière d'annoncer des progrès positifs en ce qui concerne de nombreuses recommendations.
I am proud to report favorable progress on a number of key NEC recommendations.
NEC recommendations. The primary activity in CNA's NEC action plan was to champion the top 5 in 5, the list of priority goals addressing the health status of Canadians and the performance of the health system. And you see them on the screen. Increasing the percentage of primary care practices offering after-hours care. Increasing chronic disease management and navigational capacity in primary care. Increasing Canadians' access to electronic health information and services. Reducing hospital admissions for uncontrolled diabetes-related conditions. And reducing the prevalence of childhood obesity. CNA convened different stakeholders for a consensus conference to establish those goals in June 2013. From there, we completed a final report and an action plan. We've now created the Caring Ahead series to elaborate on these priority goals with recommendations on moving them forward. The series will be released later this year after we collect some initial feedback from nurses during this very convention. Another key activity of CNA's NEC plan was furthering our Health in All Policies agenda. After much consultation and research throughout 2013, CNA is implementing a Health in All Policies action plan that aims to build public awareness and garner support among public, private, and non-governmental organizations for the adoption of a Health in All Policies approach. Nurses, especially those here in Manitoba and in Saskatchewan, may be familiar with the recent outbreaks of tuberculosis, which has been linked to poor ventilation and mold in homes. This is a prime example of where a government policy can affect our health. So when CNA was invited to present during the federal government's budget consultation talks, we helped them understand the very real consequences of unsafe or unstable housing. And we helped them understand how they could create positive change for so many people's health by making safe housing a priority. Our Health in All Policies Action Plan is available online at our website. As part of our NEC Action Plan, we have also been working on a quality safety agenda with the Canadian Federation of Nurses Unions in collaboration with Accreditation Canada, the Academy of Canadian Executive Nurses, and the Canadian Patient Safety Institute. CNA and CFNU, along with those organizations, came together in December 2013, where the group worked on identifying how to best enable quality and safety in patient care. They established priorities to act on and created a framework with which to guide our future efforts. The priorities include empowering patients and the public through education, supporting nursing students and nurses to enhance how quality care and patient safety is integrated into education, orientation, and mentorship, promoting evidence-based nurse staffing practices, and advancing strong nursing leadership, a key enabler of quality care and patient safety. This work is helping to make sure that people like you and me and our families and our neighbors can benefit from better care and better health. Other work in progress includes nursing in Aboriginal health and a national nursing education task force. CNA is a proud supporter of the North American Indigenous Games and has been working with the Aboriginal Nurses Association of Canada and the Saskatchewan Registered Nurses Association to promote health and well-being amongst Aboriginal athletes, aspiring athletes, and others who will be attending the Games. Our focus during those Games, which take place in July in Regina, will be chronic disease prevention. In May, CNA and the Canadian Association of Schools of Nursing published a report with our vision for the future of nursing education that was crafted during a national nursing education summit that brought together educators, regulators, practitioners, and students. This vision provides a platform upon which we can work together to create a national education strategy that will transform nursing and nursing education in Canada for our constantly evolving healthcare system of today. All of these projects together represent CNA and RNs leading a force for change for all Canadians. They represent a concrete and comprehensive implementation of the NEC recommendations, and they're a testament to what can be achieved through collaboration and informed goal setting. L'ensemble de ces projets représente la AIEC, les infirmières et infirmiers, autorisés, qui dirige une force de changement pour tous les Canadiens. I extend my thanks once again to NEC co-chairs Marlene Smedu and Maureen McTeer, and to the outstanding Canadians who served as NEC commissioners. The second area that this report examines is advocacy. One of CNA's goals is to shape and advocate for healthy public policy provincially, territorially, nationally, and internationally. Each year, we speak of the success of our annual Hill Day, where CNA's board meets with federal MPs and senators. The continued success of this event has led to a greater profile for CNA and for registered nurses with Canada's elected leaders. These days, CNA is consistently invited to make parliamentary committee presentations and to join in on government consultations. That gives us a direct channel through which we champion change with our country's leaders. Prominent issues in 2013 included healthy aging and seniors' care, improved access to supervised injection sites and other harm reduction measures, health benefits for all refugees, income inequality, and prevention and treatment of prescription drug abuse, to name but a few. I'd like to be able to report today that the government has readily and speedily acted on all these issues, but you well know that the pace of parliamentary change is slow and requires patience. But it also requires relentless perseverance, and we are up for that. We've already had a busy schedule with government this year, and we look forward to continuing our work with them to improve health and healthcare in Canada. Change, especially on a nationwide healthcare system base, is incremental, but our commitment at CNA is for the long term. The third and final section of my report is about membership. This topic might seem like quite a departure from the policy work that I've been speaking of so far, but they are indeed connected. C'est grâce à notre profession solide axée sur la collaboration qui d'autres fournisseurs de soins de santé, les gouvernements et les publics apprécient la voix de l'AIEC et la juge crédible. And if you can stand my French for the rest of the day, I'll keep trying. CNA's valued and credible voice with other healthcare providers, governments, and the public is made possible because of our strong and collaborative profession. Recently, there have been a few developments that affect CNA as a member association. However, at 106 years old, we're accustomed to navigating shifts in its course. I will start with BC. In our third year of having a redefined relationship with RNs in British Columbia, I am proud of how our continued work and support has ensured that the professional voice of BC nurses has remained strong. When the College of Registered Nurses of BC withdrew from CNA in 2011, a group of highly engaged, determined nurses came together to establish the Association of Registered Nurses of BC to carry on the advocacy torch. I hasten to add that our success in BC is also due to the collaborative and courageous leadership of Cynthia Johansson, CEO of the College of Registered Nurses of BC, and of course, to the CRNBC board. To Cynthia and the CRNBC Council, I extend my profound thanks. Your collaboration in ensuring that the pillars of both regulation and professional practice remain strong alongside the pillar of union or socioeconomic welfare has been transformative. Recent legislative changes in Manitoba also required a response and an action plan from CNA's board. As the new Regulated Health Professions Act will restrict the advocacy of CRNM, a group of Manitoba RNs has already come together to carry on the professional voice. As in BC, we are so encouraged by the progress thus far. Lastly, CNA is working with the Registered Nurses Association of Ontario as it implements its board's decision to give its members a choice about CNA membership beginning in November of this year. All of these changes and more are part of an organization's history, but our central focus, as always, remains on all of you, our members, and the mission and mandate you have entrusted to us. One common element amongst all three of these situations is that RNs made their voices heard in demanding the continuation of a strong and meaningful connection to CNA. Thank you to the nurses of BC, Manitoba, and Ontario for your engagement and advocacy for a strong and sustainable CNA amidst these changes. Your voices of support brought joy and hope and have enabled new possibilities. Later this morning, CNA will present a complete set of new bylaws for consideration for approval by today's voting delegates. These new bylaws are a culmination of about 3 years of work that started when the federal government announced changes to the legislation governing Canadian not-for-profit entities. I firmly believe that what we will present to you today empowers CNA to maintain its relevance and its sustainability while giving RNs in every province and territory an authentic voice. One of my proudest moments of this process was during our AGM last year, when voting delegates approved the inclusion of the Family of Nurses classification that includes retired and independent nurses and assigned voting rights at AGMs to our students. Earlier this year, at our special electronic meeting in January, you, our members, gave your approval for a revised voting rights model that more equitably recognizes the voices of each of our valued jurisdictions. I look forward to our bylaw discussion later today. Well, I've come to the end of this 2013 board report, which I have been privileged to present on behalf of my board colleagues. I offer special thanks to the many individuals and groups that have made this work possible: CNA staff, our nursing colleges and associations and their teams, and of course, our RN members. Je remercie les personnes et les groupes qui ont rendu ce travail possible. Thank you, and I now open the floor for questions and comments. It must be too early in the morning still. Very good. Well, there's lots of opportunities through the day. We do have also a section this afternoon where we will talk together.